Good afternoon, everybody. This is Art Shed of the Shed Group. I am going to do a discussion today for about 3 to maybe 5 minutes about what you need to know about the Medicare system. This presentation today comes out of a wider presentation where we're talking about 7 facts you need to know about Medicare. So without further ado, let's go ahead and get started. Medicare is a series of events by type and utilization. So this quadrant system, we're going to go around clockwise and tell you about how the Medicare system really works. So first and foremost, you see there are daily events, then there are planned events, then there are a series of one-off events, and then of course some acute events. And you see the corresponding dollar signs that will accompany each area. So when it comes to daily events, we're talking about prescription drugs. Why are you taking prescription drugs? Because you have chronic conditions. The Medicare numbers say something like 44% of all Medicare recipients, so some 60 million people, represents everybody, are taking at least 5 no, 44% of all Medicare recipients have at least 5 chronic conditions. Had to get it right. So with those 5 chronic conditions, you're probably taking a lot in the way of prescription drugs. Of course, this system is a premium system. Based on the premium you pay, will determine the copay system that you have when you go pick up your prescription, or the mail order system that you prescribe to. Your drugs are set up on a 28-day cycle. All right, so after every 28 days, you're probably getting the next month's delivery of your prescription. And of course, you see the $2 signs there for best value. You want to get your prescriptions on the generic side of this ledger, especially if you have 5 chronic conditions. You're probably taking a lot in the way of medication. So the generic tier is where you want to be if you want to control your cost in this particular space. Next, we move on to planned cost. Your planned cost happens on the Part B side of the ledger. These events are 23 hours or less in duration. You're probably going to see a primary care doctor or a specialist, and maybe they're doing some lab work or some type of x-ray, maybe a wellness visit where they spend a little bit of time with you trying to figure out what's going on. And of course, preventive services. But for the most part, remember, the reason why you're seeing the doctor is because you got some chronic conditions that require management. Okay, so those are planned events. See the corresponding dollar sign, $1 sign there. That tells you that in this space, things don't cost that much. All right. In most cases, you could probably reach into your pocket and pull out enough money and cover it for the service that day without any problem whatsoever. Okay, so those are planned events. Moving along to the one-off events, I will say these are one-off scheduled events. So think of it this way. Your doctor, you've met with him at least 2 or 3 times this year, and he says, you know, Mr. Smith, I think we need to get an MRI. Okay, it's not planned, right? But it's a one-off event, okay? So it's not something that you've been there 3 times, so it really hasn't been in the works, but they think it's time that you do something else so they can get a better view of what's going on. So it's a one-off event. Also, other one-off events could be an ER visit, could be an outpatient surgery, could be home health services, and so on and so forth. So you see the 2 corresponding dollar signs. Again, in the Part B space, it's not that expensive. Remember your agreement with the federal government. You pay a premium. They will cover 80% of the cost. Your responsibility will be 20% of the cost. That's the reason why it's not that expensive on the Part B side. By contrast, looking at acute events, these can become extremely expensive. Why? Because we're talking about Part A services. All right, 24 hours or more, you're probably looking at a Part A event. All right. And in this case, inpatient hospitalization, or it could be an observation stay. You may need some form of skilled nursing or rehabilitation, and even some home health services. Now, the home health services, probably not that expensive, but everything else listed, inpatient, observation, skilled nursing, rehab, expensive. Okay, so, and it's because of this area, the acute area. That's the reason why you need to consider some form of a Medicare Advantage or a Medicare Supplement plan. Everything else, when it relates to costs, especially on the Part B side, isn't that expensive. The Part D services that happen on a daily basis, they could get expensive if you're not watching how you're spending those dollars for those prescription drugs. So there you have it. Medicare is a series of events. You have daily events, planned events, one-off events, and then you have acute events. If you can remember this, this will go a long way into setting up what you should do next when it comes to selecting a Medicare Advantage or a Medicare Supplement. Hope you enjoyed the program. Talk to you later.